Welcome to the second video. Let's get started. Unit 1 Calorimeter. 1. What is calorimeter? Definition: calorimeter is the science of measuring heat changes in physical and chemical processes. Key concept: heat is the energy transferred due to a temperature difference. 2 key terms. Heat, Q, energy transferred from one object to another due to temperature difference. Temperature, T, measure of average kinetic energy of particles. Specific heat capacity, C, amount of heat required to raise the temperature of 1 gram of a substance by 1 degree Celsius. Formula for heat calculation. Q equals mc delta T. Where Q equals heat, joules. M equals mass, grams. C equals specific heat capacity, J/G degree C. Delta T \delta T. Delta T equals change in temperature, degree C. 3 types of calorimeters. Bomb calorimeter. Used for measuring heat of combustion. Sealed container, sample is burned, heat change is measured. Coffee cup calorimeter. Used for measuring heat changes in aqueous solutions. Measures heat during reactions like neutralization. Differential scanning calorimeter, DSC. Measures heat flow as a function of temperature to study phase transitions, melting, crystallization. Adiabatic calorimeter. Measures heat changes in reactions under insulated conditions to prevent heat loss. 4 key concepts. Endothermic reactions, heat absorbed, positive delta H. 5 calorimetry calculations. Heat of reaction. Measure the temperature change and calculate the heat absorbed or released during a reaction. Calorimeter calibration. Calibrate using substances of known heat capacity. Heat absorbed by the calorimeter itself should be accounted for. 6 applications of calorimetry. Heat of combustion, measuring the energy content of fuels, bomb calorimeter. Phase transitions, studying melting points and crystallization, DSC. Biochemistry, measuring heat changes in metabolic processes. Food science, determining the caloric content of food. Chemical reactions, measuring enthalpy changes in reactions like acid-base neutralization. 7 experimental procedure and safety. Calibration, ensure the calorimeter is calibrated correctly to ensure accurate measurements. Data collection, monitor and record temperature changes carefully. Safety, follow proper lab safety protocols when handling chemicals and using high-pressure calorimeters. 8 common issues. Heat loss, account for any heat loss to the environment, example via insulation. Accuracy, ensure precise temperature measurements and proper calibration for accurate results. MCQs VVI. 1. What is the most commonly used method for determining blood glucose levels? A. Spectrophotometry. B. Enzyme-linked immunosorbent assay, ELISA. C. Glucose oxidase method. D. Hemoglobin electrophoresis. Answer: C. Glucose oxidase method. 2. What is the main principle behind a clinical chemistry analyzer? A. Electrophoresis. B. Spectrophotometry. C. Gas chromatography. D. Chromatography. Answer: B. Spectrophotometry. 3. Which of the following tests is typically used to assess liver function? A. Complete blood count, CBC. B. Basic metabolic panel, BMP. C. Liver function tests, LFTs. D. Coagulation panel. Answer: C. Liver function tests, LFTs. 4. In hematology, what does a shift to the left on a white blood cell, WBC, count usually indicate? A. Infection. B. Anemia. C. Leukemia. D. Liver disease. Answer: A. Infection. A shift to the left means an increase in immature white blood cells, typically in response to infection or inflammation. 5. Which of the following is commonly measured using a bomb calorimeter in a medical laboratory? A. Blood glucose levels. B. Hemoglobin concentration. C. Caloric content of food samples. D. pH of urine samples. Answer: C. Caloric content of food samples. Bomb calorimeters are used to measure the energy, heat, released by combustion, commonly used in food and metabolic studies. 6. What is the principle of a spectrophotometer in clinical chemistry? A. Detection of antigen-antibody reactions. B. Measurement of light absorption by a sample. C. Detection of electrical conductivity in a sample. D. Measurement of fluorescence in a sample. Answer: B. Measurement of light absorption by a sample. Spectrophotometers measure the amount of light absorbed by a sample, often used in the determination of analyte concentration. 7. The principle of enzyme-linked immunosorbent assay, ELISA, is based on A. Optical density measurement. B. Antigen-antibody reaction. C. Gas chromatography separation. D. Mass spectrometry analysis. Answer: B. Antigen-antibody reaction. 8. In a hematology lab, what is the main use of a differential blood count? A. To measure the hemoglobin levels. B. To classify types of white blood cells in the blood. C. To identify the presence of bacteria in the blood. D. To measure blood sugar levels. Answer: B. To classify types of white blood cells in the blood. 9. Which of the following laboratory tests is used for the diagnosis of diabetes? A. Total protein test. B. Hemoglobin A1C test. C. C-reactive protein test. D. Thyroid stimulating hormone, TSH, test. Answer: B. Hemoglobin A1C test. 10. What does a positive Coombs test, direct antiglobulin test, indicate? A. Hemolytic anemia. B. Renal failure. C. Liver disease. D. Diabetes mellitus. Answer: A. Hemolytic anemia. The Coombs test detects antibodies that are bound to red blood cells, which can cause destruction in hemolytic anemia. 11. What is the normal pH range for blood? A. 6.5 to 7.0. B. 7.0 to 7.5. C. 7.35 to 7.45. D. 7.8 to 8.0. Answer: C. 7.35 to 7.45. 12. In clinical microbiology, which of the following methods is used to identify bacteria based on their ability to ferment sugars? A. Gram staining. B. Biochemical tests, example oxidase, catalase tests. C. Polymerase chain reaction, PCR. D. Agar diffusion. Answer: B. Biochemical tests, example oxidase, catalase tests. 13. What is the typical reference range for adult hemoglobin levels? A. 10 to 12 g/dl. B. 12 to 18 g/dl. C. 20 to 25 g/dl. D. 25 to 30 g/dl. Answer: B. 12 to 18 g/dl. 14. In a clinical laboratory, what does a prolonged PT, prothrombin time, indicate? A. Liver dysfunction or clotting disorder. B. Infection. C. Diabetes. D. Kidney failure. Answer: A. Liver dysfunction or clotting disorder. Prolonged PT indicates a problem with clotting factors, which may be caused by liver disease or certain coagulation disorders. 15. In clinical chemistry, which of the following would be elevated in the blood of a person with a myocardial infarction, heart attack? A. Creatinine kinase, CKMB. B. Glucose. C. Bilirubin. D. Thyroid hormones. Answer: A. Creatinine kinase, CKMB. CKMB is a cardiac enzyme that is elevated during a myocardial infarction. 16. Which of the following is the main purpose of a quality control (QC) program in the laboratory? A. To measure patient outcomes. B. To ensure laboratory equipment is properly maintained. C. To ensure that laboratory tests are accurate and reliable. D. To monitor patient blood pressure. Answer: C. To ensure that laboratory tests are accurate and reliable. 17. Which of the following components is measured to evaluate kidney function? A. Creatinine. B. Glucose. C. Bilirubin. D. Cholesterol. Answer: A. Creatinine. Creatinine is a waste product filtered by the kidneys, and elevated levels can indicate impaired kidney function. Thank you for watching the video. For more videos, subscribe to the channel, like, share, and comment. Also, share with your friends and stay tuned.